Hi friends, I'm Dr. Vandya MS. Welcome to my channel SPM World. Today I'm going to teach you regarding recent changes in latent TB infection management. Before going to start today's class, let me tell you all one thing that if anybody watching this video not yet subscribe my channel, please do subscribe and press bell icon so that you will get all videos related to recent advances in medical field that I'll upload in this channel. So let's start learn regarding recent changes in latent TB infection management. So, latent TB infection is defined as a state of persistent immune response to stimulation by Mycobacterium tuberculosis antigens with no evidence of clinically manifest active TB. On an average, about 5 to 10% of those infected will develop active TB disease over the course of their lives, usually within the first 5 years after initial infection. The risk for active TB disease after infection depends on several factors, the most important being immunological status. The risk of developing TB disease after TB preventive therapy decreases 90% from 11.1% for those not taking latent TB infection treatment to 1.2% for those taken the same. So now we want to know who all are eligible for latent TB infection management. Before that, we want to know who is household contact. Okay, household contact can be defined as a person who shared the same enclosed living space as the index patient for one or more nights or for frequent or extended daytime periods during the 3 months before the start of current treatment. This is the household contact. Then the eligible persons are number one is children less than 5 years who are household contacts of microbiologically confirmed pulmonary TB may continue to be given TB preventive therapy after ruling out active TB according to current national guidelines. Okay, this is the number one, that is children less than 5 years who are household contacts of microbiologically confirmed TB. Okay, then second one is and another thing is we have to rule out active TB, okay, before starting treatment for these children. Second one is a child born to mother who was diagnosed to have TB in pregnancy should receive TB preventive therapy provided congenital TB has been ruled out. This is the second scenario. And the third one is children and adolescents belongs to 5 to 15 years of age who are household contacts of microbiologically confirmed pulmonary TB should be systematically tested for latent TB infection. This one is important. Okay, in this scenario we have to do testing for latent TB infection. Okay, if found to have latent TB infection, they shall be offered treatment for the same, that is for latent TB infection after ruling out active TB. Okay, for children and adolescents 5 to 15 years of age who are household contacts of microbiologically confirmed pulmonary TB, we have to test for latent TB infection. Then fourth one is children and adolescents belongs to age 12 months to 15 years of age living with HIV should be given TB preventive therapy after ruling out TB. In this scenario, no contact is needed. Okay, children and adolescents of age 12 months to 15 years of age living with HIV should be given TB preventive therapy after ruling out TB, and no contact is needed in this scenario. And fifth one is children living with HIV of age less than 12 months should also be given TB preventive therapy if they are contact of a pulmonary TB after ruling out active TB. Okay, for 12 months to 15 years, no contact of active TB is needed, pulmonary TB is needed. For those children living with HIV of age less than 12 months, we need a history of contact of a pulmonary TB. And last one is children and adolescents of age group less than 15 years on any chronic immunosuppressive conditions as decided by pediatrician shall be tested and treated for latent TB infection. Okay, these are the persons that are eligible, who are eligible for latent TB infection management. So coming on to testing for latent TB infection is nowadays we are using IGRA. Okay, IGRA for identifying for detecting latent TB infection. That is, IGRA is interferon gamma release assay. Okay, this testing is needed for every eligible person except two persons. That is, those who are household contacts of age less than 5 years. Okay, for those who are less than 5 years, we don't want to test with IGRA, and also children and adolescents living with HIV. This testing is not needed. Okay, so for latent TB infection testing is we are doing IGRA, interferon gamma release assay. Earlier we have done Mando test, but nowadays we are following IGRA because this test is better than Mando test. And this is the diagnostic algorithm for diagnosis and treatment of latent TB infection. Okay, first of all, we have to screen for active TB disease, whether this person is having active TB disease or not. For that, we have to look for the signs and symptoms suggestive of TB, that is cough more than 2 weeks, hemoptysis, evening rise in temperature, like that. If the signs and symptoms suggestive of active TB disease present, then we have to further investigate for active TB. Okay, so if the signs and symptoms of active TB present, we have to investigate for active TB. And if signs and symptoms of active TB not present, that is absent, then we have to do what test? IGRA, interferon gamma release assay. In IGRA, if it is found to be positive, then we have to do chest X-ray. Then if it is negative, we don't want to do further checkup. Okay, so if found positive in IGRA, we have to do chest X-ray. In chest X-ray, if we found any abnormality, then also we have to investigate for active TB. Okay, and if no abnormality is seen in chest X-ray, then we have to find out if there is any extrapulmonary TB. Okay, for that we have to look for lymph nodes, clinical examination of lymph nodes, and any signs and symptoms of extrapulmonary TB. If any signs and symptoms of extrapulmonary TB present, or any lymph node enlargement like that present, then we have to again investigate for active TB. If it is absent, then we can treat for latent TB infection. Okay, simple. Okay, first of all, screen for active TB. Then if no active TB signs and symptoms of active TB present, then we can do for IGRA. If IGRA positive, chest X-ray. In chest X-ray, no abnormality is seen, then look for extrapulmonary TB. If no extrapulmonary TB, then we can treat for latent TB infection. Okay, this is the diagnostic algorithm for latent TB infection. Then last one is, what is the treatment for latent TB infection? Okay, as we all learned in the TB management, that is we have given fixed dose combination based on weight band category. In this scenario also, daily dose, 3 months daily dose of isoniazid rifampicin. Okay, here we are following fixed dose combination, and based on weight band we are giving treatment. Okay, so in this scenario, 3 months daily dose of isoniazid and rifampicin. For weight band, for a child belongs to weight of the child lies between 4 to 7 kg. One tablet containing fixed dose combination of isoniazid and rifampicin have to be given. Okay, for a child, weight of the child lies between 8 to 11 kg, 2 tablets, 12 to 15 kg, 3 tablets, 16 to 24 kg, 4 tablets, and the weight of the child is more than 25 kg, we have to use adult dosage. This adult dosage I already taught you in the previous class in the TB, when I take TB class, okay, tuberculosis. In that I already mentioned the weight band for adult dosage. Okay, along with this treatment, we have to give pyridoxine 10 to 25 milligram daily in order to prevent peripheral neuropathy. Okay, pyridoxine 10 to 25 milligram daily also to be given. So treatment of latent TB infection is simple, based on weight band, fixed dose combination, then 3 months daily dose of isoniazid and rifampicin, and also pyridoxine has to be taken. Okay, so these are all things for today. So today we have learned regarding what is latent TB infection, then who are all eligible for latent TB infection management, then diagnostic algorithm for latent TB infection, then finally we have learned regarding treatment of latent TB infection. Then so I hope that all of you understood this area. So thank you all for watching. If you like this video, please share with your friends and also subscribe my channel so that you will get more videos related to recent advances in medical field and public health. Okay, thank you all for listening. Thank you.